Okay, so we are going to talk about shoulder osteoarthritis. Typical epidemiology, you're going to see people over 60 years old more prone to this. Women are greater than men, and then past history of glenohumeral dislocations, AC separations, fractures, sprains, anything to the shoulder. This will give them a greater risk. Typical subjective. Patient will complain of crepitus or cracking or creaking or squeaking, whatever you want to call it, in the shoulder. They're definitely going to have trouble sleeping due to just discomfort. Anytime they roll onto it, it's going to hurt. Trouble performing ADLs because of decreased range of motion. As you'll see in my objective, range of motion is going to be very, very decreased, very resisted. Pain location, it's going to be for the GH joint, it'll be kind of the posterior aspect of that joint. And then the AC joint, you'll see more on the superior portion of the AC joint. Okay. Mike, so I read your income papers. Tell me about a little bit what's going on.
Yeah, so I play a lot of pickleball. I'm in the NPA, National Pickleball Association, and we've been just getting after it. I started getting this pain back here in the back of my shoulder the past few weeks or so, and it just has not been going away.
Okay, tell me a little more about that pain. So what's that? What kind of brings it on?
Usually when I go for a spike, I got a pretty nice spike, so when I get kind of close to the net and go overhand like that, that kind of hurts. When I'm resting, it doesn't really hurt too much if I warm it up pretty nicely. But yeah.
Okay. How severe would you say this pain is? If I were to say 0 is no pain and 10 is let's go to the hospital, worst pain you could ever imagine.
If I get really worked up in a game or a couple games, then probably like a 4.
Okay. And then how long? What is it? Let's just say on average, what would you say it is?
It usually feels like a little bit of something, so probably like a 1, but
Okay.
It does get down to a 0.
Okay, so when you get up to a 4,
Mhm.
how long does it take you to get back down to a 1 or a 0?
Probably a couple hours.
Okay.
Sometimes after games and stuff, I'll ice it, and that starts to go down after like probably 20-30 minutes.
Okay, good. So icing helps it.
Yeah.
Okay, nice. Tell me anything else that's giving you trouble with?
Not really. I mean, if I'm trying to like pick up my grandkids and play with them and stuff, that'll bother me some. Like I said, in the morning, it'll take a while to get warmed up, and then just like trying to get comfortable while sleeping is tough sometimes.
Okay, so sleeping's an issue.
Yeah.
Okay, tell me a little bit more about that.
If I just roll onto it, or I don't know, it just wakes me up a lot.
Wakes you up a lot. Okay,
Yeah.
so when you wake up, how hard is it for you to go back to sleep?
Probably like half hour.
Okay, and that is that due to like changing positions, or is that just it's a constant pain the whole time?
It's not too constant. Usually, if I roll to the other side and get away from it, it'll go away eventually.
Okay.
Yeah.
And I think I noticed you rubbing kind of like the back of your shoulder earlier. Is that where your pain is?
Yeah.
Okay.
Mostly.
All right. So trouble overhead. I heard that right. Do you hear anything when that's going on?
Yeah, sometimes it like clicks a little bit. It kind of feels like there's almost like a grind.
Okay.
Yeah, like things are just kind of running together.
Okay. Is that grindful? Is that painful?
It's definitely uncomfortable.
Okay.
Not always painful.
Okay. Tell me, have you ever had any other injuries to the shoulder?
Yeah, when I was playing football when I was little, I dislocated it a few times.
Okay. And just because we're on camera, can you state your age for me?
75.
Okay.
I think.
All right.
Yeah.
You don't look a day over 24.
Appreciate it.
Yeah.
Get that a lot.
How about any numbness, tingling going down your arm?
No.
Okay. You ever had any neck issues?
Mm-hmm.
Okay. Does your shoulder pain ever come on with neck motions, head motions?
No.
Okay.
Not that I've noticed.
Any problem bowel or bladder?
No.
So this is a typical pain diagram that you'll see. So typical objective findings, as you'll see when I go through with Mike, they're painful with both passive range of motion and active range of motion, and there'll be crepitus with both, and you'll feel it, you'll hear it. There'll be internal rotation will be probably the most affected just due to the posterior capsule and the thickening of that. And then for Sperlings should be negative, neural tension testing should be negative. Those are both kind of unrelated to the OA. And then palpation of the joint is actually not painful.
Action.
All right, Mike, you look a little different now during your objective, but that's okay. So we're gonna go through a few tests, just kind of get an idea of what's going on at your shoulder. Does that sound good?
Yeah.
All right, Mike, so I'm gonna come over. I just need to feel on your shoulder, so if you could turn around real quick. Okay, yeah, I just need to feel that shoulder. So how about any pain when I do this?
No.
No, okay. Any pain here?
No, feels good.
Okay, how about back here?
No.
No pain with any of that?
No, you can keep doing it.
Okay. First thing I want you to do is your thumbs up. I just want you to go with your right arm first. This is your non-affected arm. I want you to go as high as you can, straight in front of you. Good. Any problems there?
No.
Good. Let's see it with your left. How about that? Ooh, okay. All right, let's calm that down. How was that?
It was painful.
Okay. What would you
Yeah.
say that is?
Like maybe 6.
Yeah. Okay. How's it coming down now?
Yeah.
Okay. Good. All right, let's try it out to the side for me. Yeah. Okay.
Yeah, same thing there.
Same thing there? Okay. Is it coming back down?
Yeah.
Yeah? Okay.
Blood flow.
Okay. All right. Can you do one thing for me? Is I want you to reach. I want you to take your left arm. I want you to reach. Stand up for me, actually. Reach as far back as you can up your. Ooh, okay. How was that?
Yeah, that's about as far as I could go.
Okay. That was pretty limited, but that's okay. Let me see your right real quick, just for reference. Okay. Yeah. So you're up there. Okay. And let's go overhead for me. Oh yeah.
Yeah, it's the same. I can't get it up.
Okay. Is that painful too?
Yeah.
Okay. Is it coming back down?
Yeah, it's coming back
All
down.
right. Let me see your right for me. No problem.
Nothing.
Okay. Sit back down for me. I'm gonna do a few things. I just want you to, I want you to look up, bring your left ear to your left shoulder, and then look the opposite way for me. So here, I'll guide you through it. Now your hair looks good, but we gotta calm it down. And then like that. Does that cause anything? Okay. Stay right there. I'm gonna add a little pressure. How's that?
No, nothing.
Okay. Does it reproduce anything?
No.
Now let me do it the other way. So we're gonna do the same exact thing. So there, good, and look up. I'm gonna do the same thing. You tell me if anything changes.
Nothing.
Nothing changes? Okay. Sounds good. Can you lay back down for me? I'm just gonna do just some passive range on you. So you just let your arm relax, all right? Let me take you through. Okay.
Oh yeah, it starts to get painful right there.
Okay. And I hear some clicking there as well. Okay. Is it back down?
Yeah, it's getting there.
Okay. I'm just gonna poke out to the side. What's that?
Yeah, about right there.
Right there?
Yeah.
Okay. There's some clicking there as well.
Yeah.
You hear that?
Mm-hmm.
Yeah. Okay. I'm gonna come back out here. Okay. I'm just gonna take you here. Oh, you're tight there. There's a little bit of clicking there. Is that painful?
I feel it, yeah.
Okay. All right, we're gonna come back out this way. Oh, yeah, that's stiff right there. How's that?
That's about all I got.
Okay, painful?
Yeah.
Okay, yeah, let's relax there. How you doing? Good, pain's back down?
Mm-hmm.
All right, awesome, thank you. So the key diagnostic feature we have right now is just a simple radiograph. You'll see a decreased joint space, or you'll see abnormalities to the humeral head, like this sad face right here. And then mechanisms, symptoms, what patients will typically say if they're educated at all is that it's bone on bone, and it kind of gives PTs a laugh, I've heard. The joint spaces themselves are actually highly innervated, and so the nerve endings, when the cartilage kind of generates, become more active and they get excited easier. And then also there's evidence of hyperalgesia and abnormal central processing, especially as this goes longer on, becomes more chronic. This becomes more common. And then just like most pain, there's going to be cytokine release in the area. So what do? We treat it. PT is actually the best way to deal with this. Shoulder surgery, depending on the patient, can be iffy. So how do we do that? We take care of the pain. We gain range of motion. We strengthen the shoulder girdle, and then take into account what they want to do. So if they want to play pickleball, we're going to work on overhead motion. If they want to play golf, we're going to work on that. Stuff of the sort. Just kind of take into account what they want to do, and then advise on some lifestyle changes and then some activity modifications and how we can work on that together.